Hello friends, welcome back to the channel. So in this video today I will be discussing regarding HIV AIDS. What is HIV? What is AIDS? What all symptoms a patient will have if he is having AIDS? How HIV spreads? How it doesn't spread? What all infection a patient can have if he is suffering from AIDS? What all complications he can have? What is the treatment for AIDS? And what are the blood tests to confirm HIV AIDS? Everything regarding that I will be discussing in this video, so stay tuned. Acquired Immunodeficiency Syndrome (AIDS) is a chronic potential life-threatening condition caused by human immunodeficiency virus, that is HIV. By damaging your immune system, HIV interferes with your body ability to fight infection and disease. What all symptoms a patient can have if he is suffering from AIDS? So first is he can have fever, fatigue, swollen lymph nodes. Often of the first sign of HIV infection, he can feel diarrhea, weight loss, oral yeast infection, shingles, which is herpes zoster, pneumonia, sweat, chills, and reoccurring fever. Now we will be discussing how HIV spreads. First is by having sex. You may become infected if you have vaginal, anal or oral sex with infected partner whose blood, semen or vaginal secretions enter your body. The virus can enter the body through mouth sores or small tear that sometimes develop in the rectum or vagina during sexual activity. Second is by sharing needle. Sharing contaminated injections or needles, a patient can have HIV AIDS. Third is from blood transfusion. In some cases, the virus may be transmitted through blood transfusions. Next is during pregnancy or delivery or through breastfeeding. Infected mothers can pass the virus on to their babies. Mothers who are HIV positive and get treatment for the infection during pregnancy significantly lower the risk to their babies. Now I will be discussing how HIV doesn't spread. By hugging, kissing, dancing or sharing hands with someone who has the infection, HIV doesn't spread through air, water or insect bite. Now I will be discussing infection which is very common in HIV AIDS patient. First is pneumonitis pneumonia, which is called as PCP. Second is candidiasis through. It causes inflammation and a thick white coating on your mouth, tongue and esophageal or vagina. Next is TB. Tuberculosis is a common infection associated with HIV. TB is the main leading cause of death in HIV patient. Next is cryptococcal meningitis. Meningitis is the inflammation of the membrane and fluids surrounding your brain and spinal cord. Next I will be discussing what all complications you can have if you are having AIDS. First is wasting syndrome. Untreated HIV AIDS can cause significant weight loss, often accompanied by diarrhea, chronic weakness and fever. Second is neurological complication. HIV can cause neurological symptoms such as confusion, forgetfulness, depression, anxiety and difficulty in walking. Next is kidney diseases. HIV associated with nephropathy, HIV-AN, is an inflammation of tiny filters in your kidney that remove excessive fluid and waste from your blood and pass to your urine. Next is liver disease. Liver disease is also a major complication, especially in people who have hepatitis B or hepatitis C. Now I will be discussing the treatment aspect of HIV AIDS. There is no cure for HIV AIDS, but medication can control the infection and prevent progression of the disease. Antiviral treatment for HIV has reduced AIDS death around the world. You can consult any private practitioner for this antiviral therapy or you can visit the ART antiretroviral therapy centers in any nearby government hospitals. Now I will be discussing the blood test to confirm HIV/AIDS. First is ELISA test. The test is done in the first day. For reconfirmation, again it is repeated after 3 months. Second test is P24 test. Checks your blood for an HIV antigen called P24. This test will give accurate results only after 30 days post getting infected. I hope everything regarding HIV and AIDS, what all doubts you are having, is cleared in this video. If you want to see the same kind of medical content in future, don't forget to subscribe to the channel. If you have liked the content, then press the like button and share this video as much as possible. We will meet you in another video with some new and good content. Till then, take care. Thank you.